This is Dr. James Aligbele. Welcome to this channel today. I'm a consultant physician and also your health coach on this program today. I will be talking about another very interesting topic around health transformation. This channel is called the 6 Domains of Health. It is an health transformation hub whereby we are bringing a more holistic approach to how we can improve individual as well as our community health and well-being. And today's topic will be very interesting. The title is called "Why is Psychosocial Model of Health Uncertain?" And let's dive into the program today. Today you'll be learning about the current global health issues around the models of health that we've had in the last decades. We'll be also looking specifically at the current model of health that we use, and then to see whether it needs changing, whether is it a model that will be able to meet your current health education program as well as improvement programs. And then we'll be looking at why the causes of many diseases still remains unknown. And then we'll be doing a comparison between psychosocial model of health versus the 6 domains of health. How do they relate and how do they what is the difference between them? And then we'll be mapping your healthy lifestyles around the 6 domains of health. In the next video following this, we'll be mapping the current healthy lifestyle to see how do they really overlap within the domains of health. And then we'll be looking at the health interventional approach that will help you to embark on a very comprehensive, holistic health as well as wellness. As you know, there are many people talking about health and wellness. One thing about it is that it's a very niche focus, meaning that by the time you look at what people are offering you, many of them are centralized around a single domain of health, which is the physical health. You might see somebody selling you a program around nutrition, which is just about 2% of what is contained within the domains of health. Or that you might be even subscribing to exercise program, which I also do as well, making sure that I exercise regularly. But it seems to me, from my experience of dealing with people and having been a doctor and consultant for many years, that that concept and approach may not be comprehensive enough in helping you to prevent or to deal with any incipient or onset of any disease to tackle about. And the current global health issues is very enormous, and it's a big challenge, not just only to the healthcare practitioners or professionals, and it's also a problem to government and to even individuals as well. We're seeing rising costs of healthcare worldwide. We're seeing people receiving very expensive healthcare, and then eventually the treatment doesn't work. And then we're also seeing that the world population is rising at a tremendous rate, and people are living longer, but they are not living longer with good health. We're seeing people dying young. We're seeing people who also their lifestyles of maybe with bad habits ending up with a premature death. For example, we've seen people drinking enormous alcohol. We've even seen people, young people, going into very complex addictions and without any solution to their issues. And then the devastating effect of COVID-19 pandemic is still on the run, and meaning that there is still more to do. We oftentimes seen from the statistics that there are 42 million people dying annually globally from non-communicable diseases, and also we have about 33% of which are caused by cardiovascular diseases, and then 80% are due to communicable maternal, perinatal, as well as nutritional conditions, and 17% are due to cancers, and then 8% due to respiratory diseases, 3% are due to issues around diabetes, and 8% are due to injuries from various sorts of issues, and then 14% are probably unknown. So there are so many other problems which are caused by addict or addiction, or due to lifestyle that people have embraced to try and make sure that some people have gone into harmful alcohol use, and then there are many works that involve sedentary lifestyle with less physical activity. We've also seen people backing on tobacco use, although the trend has diminished, but we now see people who are using vaping, thinking that vaping might be risk-free. But I think we will be able to tell in the next years to come whether vaping is disease-free. We also seen impact of diabetes, hypertension, obesity, as well as nutritional deficiency and poverty. So let's look at models of health that we have or that we have adopted over the years. Initially, it was necessitated that we should have a model or operandum that we should use in our healthcare system. For example, we had the biomedical model, which often mean that an attempt to try and define and also cure disease using biomedical sciences. And then also we realize that disease are not just only in the physical body. There are people with mental health problems, and there are also people with emotional health. There are even people emerging various kind of social related diseases that are emerging that are overlapping between social as well as emotional problems. For example, we have people who have not been able to leave their house because they have agoraphobia. And we're even seeing young people now with attention deficit hyperactivity disorders. And we also have a social model, and then also the situational handicap model, and then the quality of life model, and the current one, which is the biopsychosocial model of health. So what does this really mean? That we can now divide this into biological factors, social factors, and then psychological factors, which are the determinant of various diseases and also health problems. So the psychosocial model of health was originally presented in contrast to the biomedical model that dominated medical training as well as practice, and challenged the credibility of psychiatry as a field of medicine. So before, there was no specialty like psychiatry, but now we have psychology, and we also have psychiatry. The psychosocial model highlight the contributions of biological, psychological, and social factors in determining health. And it's also an interdisciplinary as well as multifaceted model, that posit the interrelations among the biological, psychological, and social environmental influences on health and diseases. For example, the biological factors could be bacteria, viruses, fungal, or any other reason which are biological factors that affect human health. The psychological factors may be people are developing anxiety or depression, or people with other psychological stress. And then the social factors are also emerging, meaning that we have seen people who may have disease as a result of social determinant of health, especially when you look at the third world country where poverty is a problem. So you may see diseases relating to poverty as well as other issues as well. So we do have research in social somatic and neuroplasticity as well as social genomics as well. So there are also many systems within our body, with each of these systems in itself is formed by a complex interconnected set of structures and cells. For example, the immune system not only operates to determine or to deter infection and disease, but also interact with other biological dynamics such as the circulatory systems and with social and psychological dynamics. So the psychological dynamics include cognitive, emotional, motivational, attitudinal, and behavioral systems that affect health. Considerable research in health psychology has probed the role of self-identity, personality, coping strategies, substance use and addiction, stress appraisal, emotions, illness schemas, anxiety and depression, and health behavior in understanding physical and mental health. So Sauce and Roman note that social considerations are more neglected than other domains captured in the psychosocial model. And the interpersonal dynamics include direct contact with others as well as reverberating consequences of other action. For the purposes of this paper, we highlight the importance of macro level contextual factors to be also discussed. Then let's look at the critiques of psychosocial model of health. There are many issues around lack of mental health diagnosis. Then moreover, 25% of hospital outpatients have problems that are not accounted for by any disease as well, or diseases that cannot be explained by biomedical or by psychosocial model. And then the existing model of care around the world have been shown to be both financially unsustainable and inequitable. So when you look at the concept that existed over years, we do know that human being does not exist as physical body alone. Although as science, we've been studying intensively the mechanism, the physiology of human body as well as the anatomy. But over the years, we have realized the inclusion of knowing the importance of human soul as well as human spirit, which is the inner core of man. Although the souls and the spirit exist within the spirit realms, but our physical body exists in the physical domains. So the tripartite nature of man is as real as the physical body alone. For example, somebody may have the physical body. You may have somebody with pulmonary embolism or pneumonia. Within the soul, when you look at the roles of the souls, the mind, the emotions, the intellect, within your souls. So there are people that may have emotional as well as mental health disorders. And then within the spirit, although it's a weird, you may have people with very weird symptoms. It may be related to their functional disorders, or it may be even related to disease that you're seeing physically. So it is important for research to begin around the studies of mental disorders, emotional disorders, as we have been doing, and then also looking at the role of human spirit in as an entry point for many diseases. The psychosocial model of health currently, as I explained, looking at disease as biological factors, psychological factors, social factors, and then you can see that the model fails to take into account the nature, the tripartite nature of man, and that there are other entry points of illness, such as the human mind and the human spirit. So there are diseases that may exist within the level of the physical body, which is the majority of illnesses, and there are diseases which are mental health problems, emotional health problems, which are within the souls of the man, and there are also a understanding emerging from various activities that are indicating to us that there are diseases that may be emanating from the spirit of the man as well, which are caused by other unknown spiritual reasons or spiritual determinant of health. So it is important, just like we have social determinant of health, it's also important to start accepting my assumption that we have spiritual determinant of health as well. So when you look at the 6 domains of health, it is very more comprehensive. We acknowledge that we need to also be accepting the role of spirituality in human health as well, which is also looking at spiritual health. The 6 domains include the physical health, social health, emotional health, family health, mental, and as well as spiritual health. So when you look at the interaction of the 6 domains of health, you could see that these domains intercorrelate, and oftentimes you may have somebody having one issue in the one domain and then causing or relating to or interacting or interrelating to other domains of health. Let me give you an example. For example, if somebody has mental health problem, so studies have shown that they may also be having physical health issue as well. If somebody has marital breakdown, invariably the person may start developing suicidal ideation, suicidal attempts. So you may see that sometimes they over relate. In terms of spiritual determinant of health, depending on the state of your human spirit, may determine whether or predict the likelihood of you also developing certain illnesses. So it is very important to try and understand this concept and to try and you as a person to try and take hold of your own health, because you don't have to wait for healthcare professional to nurture your own health for you. It is your responsibility, and that's why I agree with the current move of the government for self-care as well as self-management. As a doctor, I really support the idea that it is responsibility of individual to seek attention to also nurture your own health, rather than expecting doctor to do everything for you. So our health interventional approach, we believe that knowledge is power. So we've put together a health literacy program that will help people with various health related skills that you need to have, as well as self-efficacy, as well as various health behaviors that are very bad and those ones that are very positive for you. We put everything together as a package for you within what we call the 6 domains of health course. So, and then for anyone also interested, we are embarking on seeing how we can provide comprehensive health coaching approach for people as well as people may need counseling and to see how do they embark on a more holistic health transformation when disease is letting you down. We do have our online training intervention as well, which is part of this video. Go to our YouTube channel at the 6 domains of health, where you can see. We also have recently we've created the course, which is the 6 domains of health course on health and well-being, involving teaching you how these 6 domains of health interlink together. And also we will like you to subscribe to this channel and also share this video with any of your friends who may benefit from this knowledge. And then if you still need any question, or you want to subscribe, or you want to subscribe to the course, is one-time free, one-time fee. There is no monthly subscription, and then you have a lifelong time to look and to study the material. And please join this very exciting program. It's a lifetime, and also you have a lifetime access, and you also have a lifetime to be able to get any update on the teaching program as well. And then hoping to see you soon in one of our programs. Thank you very much for listening to this program, and we'll see you again next time. I am Dr. James Alegbele, your partner in your health transformation program. See you again very soon. Take care. Bye-bye.